injured liver or who had this insensitivity problem, T4 going into T3 instead going into reverse T3, which is useless. It doesn't help the neurovasculars. So, what is the role of thyroid hormone receptor data in hepatic lipid metabolism? It transfers free fatty acid. It optimizes mitochondria to deal with the mitochondrial biogenesis. इसको बढ़ाना भी और उसका काम भी अच्छा. This oxidative stress, if you take only this measure in life in general and human physiology, you do so-called oxidative stress, it leads to organ damage, be it liver, be it kidney, be it heart. We call it endothelial dysfunction, and as a result, whole cascade of problems. And basically, this thyroid hormone receptor data, if it's working and it's in good shape, it helps you with a lot of things. Your mitochondria is good shape, your oxidative stress is low, your free fatty acids clearance is good. Now, so this job, Resmetirom, 2 years back. First of all, whenever there is a new drug, we do a trial that is without side effects. Efficacy is the last, second step. So in the United States, I think it was more than 12 centers involved, and more than 1,200 patients were enrolled just to see the tolerability. Okay. Then for initial 52 weeks, then duration was extended to other 52 weeks, more than 700 patients. And what they were looking for was resolution of fibrosis with a biopsy. And there was, from this to this, let's concentrate on this. They did biopsy and there was significant improvement. When data was presented to FDA, they did what we call expedited approval of this drug. And this trial is still ongoing. Total 20 centers in the United States, more than 3,000 patients. The trial will continue for 5 years just to see how much further reduction is the disease. So this is a study published in New Journal, England Journal of Medicine in February 24. The primary liver biopsy endpoint and secondary endpoints. So NASH resolution, fibrosis improvement, LDL cholesterol. This is placebo. This is 80 milligram. This is 100. And you can see, ladies and gentlemen, across the board, smart change from baseline and this is placebo. This is 180. And you can see ALD down, AST down, GT down, sex hormone gland, binding globulin. So, how it works? Thyroid hormone receptor beta agonist. This increases the uptake of free fatty acid from circulation. Free fatty acid circulation. De novo lipogenesis, mitochondrial biogenesis, fatty acid oxidation, cholesterol metabolism, increase LDL receptor expression, direct anti-inflammatory, anti-fibrotic. So, 80 and 100 milligrams. If your patient is less than 100 kilogram, give them 80. If it's more than 100, one should not be using this drug if your patient is on geritol. This is for triglyceride. I will cite the story. If your patients are on lipid-lowering agent, the dose should be carefully monitored. Ideally, proostatin and should be give 10, 20, one should be very careful. And what are possible problems? Diarrhea and nausea. As we speak, we have close to 150 patients already on this drug, and only a couple have mentioned diarrhea, which was not serious. So this is paradigm for initiating Resmetirom. You, as Dr. Farman mentioned and Rabia, rule out other problems. Okay, some storage diseases, drug-induced liver injury, and if you have a patient, we don't have FibroScan readily available in some cases. Do their CBC if reflex is more than 100? FIB4 is more than 2. It's easy calculation. And FibroScan in our practice, 7 kilopascal is normal. Anything between 7 and 12, it's considered F2, F3 fibrosis. Treat them. You should be a little bit cautious if your FibroScan reading is more than 12, platelets are less than 110,000. And do not treat. I've seen a couple of patients, they were throwing up blood, decompensated sources, and were started on this drug. So let me give you the final. We have, as we speak, even in our country, हम 25 करोड़ हिंदू बताया जा रहा है उसमें इजीली 6-7 करोड़ को मैसेज उस 6-7 करोड़ के अगर आप 20% की ले लेना दे और 25% तो 1.5-2 करोड़ लोगों को फाइब्रोसिस है and they're sitting on a potential one. Rabia mentioned to you, so basically good history, CBC, LFVs, and FIB4. उसमें एक है ASTF platelet है अगर if it's more than 1.3 safely you can start and money